whatever he said. And doctor had empathy for the patient. He smiled at me. He treated me. He assured me. And there is no need for communication at all. And with the minimal communication, we had a good experience with the doctors. All the patients never complained against doctors in those days. That was the silent era. That means silence, I mean, there is a minimal communication. But civilization doesn't stop. Days change. Days change. There is a progress. In how this progress is there. In our country, let us take in our country, literacy rate will improve. Availability information is more. Print and electronic media, internet, public awareness programs brought more information to the people. And there are technological advances available for common man. I never dreamt that MRI would be available in a village like Ragolu. Now it is available. I never dreamt that kidney transplantation could occur in Ragolu gems. It happened. So much technological advances come and help the common man. And there is a better per capita income now. And simultaneously, consumerism has crept into our lives. And there is a human attitude has changed. We have become self-centered people. Where those days we were having a combined families, now we have single families. We never live with our parents. We never live with our brother. We live alone. My wife, my children, that's all. That's my family. And so, everything self-centered attitude has come in. And there is a corporatization. Entire things change. The outlook of the society has changed with the corporatization. This is we call it civilization. Yes, there is a change. We have to accept this civilization. So what are the consequences of the civilization? What is the reality? What happened? So there is a change of attitude in the patient and the doctor. When it comes to when these changes are adopted in our medical profession, what happens? We have to accept certain things. Now the present generation doctors, they lack respect to the patient. First, let us think about ourselves. Then you can blame others. What the patient expects? Patient expects polite behavior. How many doctors behaved so politely, made the patients comfortably? Please think about it. Does not spend time with patient. Doctors are least bothered to spare more time. All is in hurry. And they are not bothered. And what patient expects? Patient expects more time to spend. Must be heard. And present generation, with the availability of the technology, now internal cerebral hemorrhage can be diagnosed in no time. A altered sensorium patient can sent to MRI, in no time you get the diagnosis. Cerebral hemorrhage, subarachnoid hemorrhage, or infarct, something is. In no time the diagnosis is with you. And our generation of doctors least bothered to look into the patient, look at the patient. Find out whether I can make a diagnosis without the help of MRI. We are least bothered. Why should I bother? Why should I? Tomorrow I'll practice. When I'll get order, patients are ready to pay money and I'll get MRI. Why should I bother to elicit the sign? What is plantar? Is flexor, extensor, the pupil is dilated or not? Why should I see? That is the attitude of the people now. So, the reality is that doctors lack interest in clinical assessment, but the patients expect the clinical judgment. Once this doctor sees the patient, without the technology being applied, if the doctor makes a diagnosis, patient will be more happiest and they will develop trust in you, they believe you, they will adore you, they will respect you. But that's what patient's expectation. That's what we are doing. And present generation is technology driven. Everything through technology. By smartphone, by MRI, by CT, by ultrasound, by endoscopy, everything. And what is this technology? Technology is more expenditure. And what patient expects? Patient feels better if expenditure for technological investigations is less. And there is inadequate communication. Which doctor felt that, yes, I could communicate everything to my patient and patient feels comfortable? How many doctors felt like that? No. This is the amount of information I need to give. I gave you. Okay, goodbye, thank you. Please, next patient. This is what, how it is. So, there is inadequate. But patient's expectation is, there is an elaborate explanation about the situation, its consequences. Sir, my father has come to you with the altered sensorium. Sir, what is going to happen? He is going to die. He is going to improve. What is actually happened? These doubts want to be cleared. You say, no, I sent for MRI. After MRI comes, I will talk to you. That's all. But patient's attendant or patient goes out of your room with a vacuum in their mind, with dissatisfaction, some incompleteness. We never address to those human behavior, those the qualities of human behavior. And unfortunately, we have our own vested interests. We have our own vested interests, like some benefits, some conveniences, some all those things. They play a role in your behavior with the patient. And unfortunate thing developed by the patient scenario is the involvement of the local political power, because all patients are the vote banks. So now our society is politically centered. Once upon a time it is a bureaucracy centered. Now it is a politician centered. So everybody wants to impress the vote bank. So all politicians are behind the patients. If a patient complains anything, the politician will come into the picture immediately. Or the supporters of the political system will come into the picture and they start arguing with you on behalf of those innocent patients. So that is the scenario. This is the reality. Am I speaking lie? This is the factual things that is happening. So in this scenario, how to improve this scenario? But I am trying to improve, but this cannot be improved because I told you, no, society is changing. Doctor is no more considered as a doctor who is caring us. He is treated like a service provider. Patient is a service user. So the relationship between these two people have become little mechanical, more mechanical. Yes, please come. Sit. What is the problem? Yes, this. Okay, take this, take that, do that, this. Goodbye. And less humane. The human behavior is that compassion and all those things are missing. Is not trustworthy. People are not believing us. And we don't believe them, they don't believe us. You can't blame each other. And there is a scant respect for each other. The basic quality of respecting the others is missing in the present generation. Very unfortunate thing. The present generation and future generation. You respect the other human being. First, the basic thing is forget that you are a doctor. If you have that, that's all. Your war is won. 50% of your thing. Your relation with the patient will be improved. But we don't have that. And we have become suspicious with each other. This is the perceptions of the people. People in all sorts of people, they change like this. So, from silent era, now we have entered into the violent era. So, the present era, now we are scared. We have been discussing these things, violent attacks for these 2 days. We have spent time for discussing all these facts for 2 days in this conference. That means so much of the magnitude of the problem is becoming so much. This is people are scared of it now. So what people are thinking, why this become violent era? When when you treat a patient, when the outcome is very poor, then your people say that you are negligent, because you are not treated my patient well, so you are negligent. People are saying that. When the patient is happily recovering and going home, they will simply think you have charged well, so you gave the result. But they are not appreciating your effort, your knowledge, your skill, your experience. That is the mindset of the people that has changed. And violent reactions in these things, violent reactions of the patients' attendants have come into picture. If you are not doing well, people are saying negligent. They want to throw blame on you. For their own reasons also, they throw the blame on you. And of course, partially we are also responsible for that. What happened? Once the violence reaction is coming up, then the political scenario is, especially in villages scenario, especially in our places, then the politician-backed people want to impress the patients. Tomorrow they are vote catchers, no. So that's why they will come into picture. They will fight with us on behalf of them. And finally, doctors is becoming the victim. Doctor doesn't have the skill of handling those people. We are trained to